Hello again, this is Matt Miller. I'm here at my office in Huntsville, Alabama. Wanted to talk to you today about something that people ask me about a lot. And the people that ask me this are not only my peers in the mental health treatment world, the counselors, the social workers, psychologists, psychiatrists, but people ask me in other walks of life as well. What's the difference between counseling and coaching? What do you do in a coaching session that you wouldn't do in a counseling session, and vice versa? So I just wanted to put some words to this and not kind of leave people out there wondering, because I believe that as far as coaching is concerned, it's not been around as long. At least we haven't always called what I'm going to define as coaching. We haven't always called that approach coaching. Maybe we called it consulting. You may have described what you did as a consultant. You may have called it coaching people up in organizations or on teams in groups. In the counseling world, I think it's fairly well defined that what a mental health care treatment professional does is they do health care, but primarily working with emotionals, psychiatric, psychological things. So I want to make sure that I kind of put my own words to this and say that for counseling, the thing that most people probably understand to at least some degree, there's talk and listen dynamics going on. So this talk therapy, maybe you've heard it called psychotherapy or therapy. I want you to know that counseling, for the most part, and really what I've done the majority of my career, what I got my training on, what still to this day, what you're going to get training in if you're looking at counseling versus coaching, and we're talking about mental coaching or leadership coaching or performance coaching, mindset coaching, probably you're still not going to find a lot of academic institutions having classes, having degrees that have to do with the type of coaching that I do. And I want to be very clear here. I'm not, and really don't consider myself what would be called by popular culture a life coach. To me, life coaches kind of came out first in a way. When we think about coaching, the thing that's always been something that I think is very important that you as a consumer or a potential client of a coach is that you look into the credentials to see if they even have a credential, see what it is that they say that they're going to be doing with you, how they can create value for you if you're looking for coaching. Maybe you work in a business, maybe you're an entrepreneur, you manage large groups of people. Maybe you're an athlete who really is trying to take things to another level. Maybe you're trying to go from high school to college. And despite whatever sport it is, you've noticed, and maybe your parents, maybe other coaches, maybe teachers have noticed that you have maybe just a mental block keeping you from really fulfilling and showing the world what you're truly capable of. But in the counseling world, there's plenty of academic rigor that goes along with programs that are designed specifically for degrees in counseling and other social sciences. So for me, I spent the majority of my career getting the training, working, really starting at the bottom level from an employee standpoint who needed at least a bachelor's degree, right, to work in a place where there's a lot of talk therapy that ultimately goes on. So we're talking about hospital settings, alcohol and drug rehabilitation settings, both inpatient and outpatient, and of course outpatient counseling offices or psychotherapy offices, if you will, mental health offices. this is really where I've gotten the majority of my experience and definitely where I got my training. And this is also where I learned that in the field of counseling, we're primarily taught to treat psychological problems. In essence, we're dealing with people who have different types of psychopathology. We're dealing with people who have chronic, persistent mental illness. We're dealing with folks who really could be diagnosed with the Diagnostic and Statistical Manual of Mental Disorders. Right now, we currently have the DSM-5, something I'm really proud to have been involved in the research and the preparation and the creation. One very small piece, but nevertheless something that I can put on the resume. But in all my years of working with psychopathology and working with people with addiction issues and depression and anxiety, even personality disorders, what I learned is that there seemed to be this whole segment of society, really the majority, statistically speaking, of people out here, although they may have periods in their life where they're experiencing, extreme mental health issues as a response to different real life situations, people passing away, things like divorce, all kinds of conflict resolution issues, job change, career change, performance issues in their professions. But there's this whole segment of society here where maybe you're fairly well adjusted and even accomplished in certain areas of your life. But what if the majority of people who aren't chronically, persistently mentally ill, they don't necessarily meet the criteria in the DSM-5 for diagnosis, but what if they just don't feel fulfilled? What if they, in their circle of influence, their family, their friends, their co-workers, teachers, what if they just haven't yet found what really speaks to them as far as what they want to do with their life? This is really an existential type of question. It's maybe to some people only meant for philosophical conversations with friends over dinner. But this is the world that I live in, and this is something that I'm very passionate about. Not only helping people with the skill set I've developed and just the experience, and I think hopefully for as long as I'm doing this, I think I really care and have sympathy and to an extent empathy when it comes to people suffering from real clinical mental health issues. But I'm also so passionate about using some of the things that I've learned in helping people who are, let's say, sick, and helping them get better. What I always thought is why don't we use this with successful people? What if it's true that I heard somebody say that good is the enemy of great? What if that's the thing that I've been trying to do all these years? Even when I was in school, I remember having these ideas of, if you learn to sit with a client and teach them how to dispute irrational thinking, well, couldn't that also work with a high-achieving, upwardly mobile, motivated, well-adjusted, high-functioning person? And so in the coaching world, we're not necessarily trying to diagnose or work on psychopathology or help sick people, although they sometimes have issues like we all do. For the most part, you're trying to help facilitate change and help them truly fulfill and become, let's say, self-actualize. So counseling, coaching really could be seen also as the difference between a lifeguard and a swim coach. I've heard this used in some of the physical fitness coaching environments I've been around. You can imagine the difference between a swim coach and a lifeguard. That'll really tell you the difference between a counselor and a coach many times. Thank you guys for listening. Have a great day.